Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Appendicitis and its signs. So the main important signs, first is we deal with the Dunphy sign. So the Dunphy sign is nothing but a pain on coughing. So in this sign there is a pain and this will be on cough. So there is a pain on the cough and this will be seen in terms of the acute appendicitis. So it is seen in terms of the acute appendicitis. Then we move on to the rousing sign. So Dunphy sign is the pain on coughing. Next is the rousing sign. The rousing sign is the pain in the right lower quadrant during the palpation of the left lower quadrant. So right lower quadrant pain, and this is seen in terms of the palpating. So you palpate the left lower quadrant and then you get a pain in the right lower quadrant. So this is seen in terms of again the acute appendicitis. Now moving on, we look at the obturator sign. So obturator sign, here it is the pain in the internal rotation of the hip. So there's pain. So pain is seen in the internal rotation. So internal rotation of the hip, there is a pain, and this will be seen in the pelvic appendicitis. It is seen in the pelvic appendicitis. Then we look at the iliac-OS sign. So iliac-OS. So in the iliac-OS sign, it is a pain in the extension of the hip. So there will be pain, and this is in terms of the extension of the hip. So obturator was in the internal rotation of the hip, and iliac-OS is when you extend the extension of the hip. So here what is involved is the retrocaval appendicitis. So it is going to be the retrocaval appendicitis. Next we move on to the Aron sign. So by Aron sign we mean the pain or pressure in the epigastrium or the anterior chest. So there is pain. So pain or the pressure in the epigastrium. So pain or pressure is seen in the epigastrium or the anterior chest, or it is seen in the anterior chest. So what this does is with the persistent firm pressure is applied to the McBurney's point. This is the pressure which is applied to the McBurney's point, MB point. This will be the Aron sign, and this Aron sign is seen in terms of the acute appendicitis. Then we move on to the basilar sign. So this basilar sign means that there is a sharp pain. So the sharp pain is created by compressing the appendix between the abdominal wall and the ileus. So sharp pain. So how do you generate the sharp pain? The sharp pain is produced when there is a compression of the appendix. So this appendix you compress. So this appendix you compress it, and this is between the abdominal wall and the iliacus. So between the abdominal wall and the iliacus. So where is this seen? This is very significantly seen in terms of the chronic appendicitis. The chronic appendicitis. Then the next sign we are going to see is the Blumberg sign. Blumberg sign. So the Blumberg sign is a transient abdominal wall rebound tenderness. So it is a transient abdominal wall. So it is a transient abdominal wall, and this is with the rebound tenderness. It has a rebound tenderness. So where is it seen? It is seen in terms of the peritoneal inflammation. So it is seen in terms of the peritoneal inflammation. Next is the 10-horn sign. So there is something known as a 10-horn sign. So that is, the pain is caused on the gentle traction of the right testicle. So there is a pain. So this pain is caused by the genital traction. So this pain is caused by the genital traction of the right testicle. So this is seen in terms of the appendicitis. To learn and grow daily like this, please do subscribe.